Hi, I'm Dr. Sunil Richardson. In this short video, we're going to try and tell you the answers for some of the most common questions that our subscribers ask us again and again. So Kathy, can you ask me those questions one by one?
What is genioplasty?
Well, the very basic question, what is genioplasty? Genium refers to a point here in the chin inside, and so any work around that is called genioplasty. Otherwise, it can also be referred to as a chin job. Like you do work on the nose, we call it rhinoplasty or also nose job, and similarly a genioplasty or a chin job.
Will there be scarring?
No, absolutely no scarring, because we do all of these procedures from inside the mouth, so nothing is going to be visible from outside whatsoever.
How much downtime is required for the procedure?
Here at Richardsons, it just takes a couple of days to get your genioplasty done. And as I mentioned, the genioplasty is to move this part of the chin, not necessarily in one direction, that is forwards. We can also take it backwards. We can take it on the sideways. That means you can make your narrow chin broad. We can make your broad chin narrow. And we can also get your vertical height more. So if you have a short chin this way, we can make it longer. Short chin this way, we can make it longer. So basically, it's a three-dimensional genioplasty that we're talking about. And whatever that is, it still just takes 2 days here and another 4 weeks of total healing.
Is genioplasty safe?
Absolutely. If it's done by an experienced surgeon who has a lot of cases, it's very, very safe, predictable procedure.
Does it hurt?
Very common question, does it hurt? Fortunately, it doesn't hurt because we do it under general anesthesia, and as we come out, I give them long-acting pain blocks. These blocks make sure the patient is not having pain for the next 24 hours, and by that time, we put the patients on pain meds for 4 days. From day 5 on, there's no pain.
Will I have numbness or loss of sensation after the surgery?
So typically what happens is about 30% of patients have some temporary numbness in this area because of the nerve, the mental nerve. I tend to stretch that a little bit, especially in some types of genioplasty. But after 2 weeks, they're going to feel perfectly fine. And the remaining 70% of the patients, there's going to be no numbness even for a short period of time.
Who needs to go for chin augmentation?
Absolutely good question. I think chin augmentation is something that is very, very essential for patients who have different self-esteem issues. So you can get a stronger personality. A stronger chin is a stronger personality, and therefore a chin with a strong genium, or rather a strong chin, gives a good result. So anyone who desires to have that can undergo that. Anyone who has a short chin in any dimension, we can undergo. I basically think there is a very unique male genioplasty and a female genioplasty, and like how we tailor make noses for faces, we also tailor make chins for faces. So genioplasty, a type for the particular face.
Will this bring me happiness?
Well, we can change your facial aesthetics. We can get you that much extra mileage out of the way you look. We can make you feel better. But if you're looking for that eternal happiness, I think this isn't a procedure. For that matter, no surgery is a procedure.
What makes a beautiful chin?
A beautiful chin is actually a proportion. So if you have a face that has a nice proportion, and then you can say that as a beautiful chin. The angle of the curve of the chin, the position of the chin, the width of the chin, the height of the chin, the depth of the chin, the position of the lower teeth, all together constitute a nice chin. And also there's a variation, as I mentioned earlier, between a male chin and a female chin. So all of this together, I think, constitutes a nice chin.
How long should I wait before a chin revision surgery?
Very pertinent. Yes, I do have a lot of patients who come for revision genioplasties or revision chin procedures, and I tell them, look, you got to wait a minimum of 3 months. I'm not going to be touching them before 3 months, but 6 months is really ideal. So if they can wait for 6 months, then we can definitely go in, can definitely get the position, we can definitely get a revision genioplasty done.
Are chin implants better?
Well, in one word, I would say they aren't better. Let me try to tell you the reasons why. A lot of chin implants just do one thing. They are useful for chin augmentation, and mainly in this dimension, in the horizontal aspect. I just mentioned earlier, a genioplasty, however, is more versatile. Yes, it needs a lot of skill, different skill sets, but as far as the patient is concerned, because we can give you a three-dimensional effect, we can move the chin in any direction you want a genioplasty is far superior than a chin augmentation. Does it mean that there is no role for chin implants? I don't mean that. There is still a role for chin implants in certain patients when you just need that bit advancement along with some other procedures. You can still go for chin implants. Thank you. So are we done? So that's about the main question, the 10 questions you want to know, or the 10 answers you would want to know before you get a genioplasty done. Thank you.